video, we will examine health disparities in the fields of refractive errors and cataracts. We will begin by defining these conditions, discussing population health, then move on to barriers and social determinants before concluding with recommendations for the future. So, what are refractive errors? When there is a mismatch between the eye's axial length and its optical power, light is not successfully focused on the retina, causing a refractive error. The three main categories are myopia, hyperopia, and astigmatism. On the left is a simulated picture from the perspective of a patient with astigmatism to help you understand the impact that refractive errors can have on vision. When uncorrected, they can cause mild to severe visual impairment or blindness, leading to a decrease in quality of life, independence, and mobility. Fortunately, effective treatments exist for this condition. Patients can receive eyeglasses, contact lenses, or refractive surgery. All of these have different costs and safety considerations, so for more information, visit the American Academy of Ophthalmology website. Now let's discuss cataracts. They are an opacification of the lens due to oxidative stress. Patients can complain of blurred vision, glare, and halos from light, or decreased visual acuity. Left untreated, cataracts lead to vision impairment and sometimes even blindness. This picture from the American Academy of Ophthalmology simulates changes that can occur with the progression of cataracts and demonstrates how debilitating this disease can be. Vision impairment caused by cataracts has been associated with depression and an increased risk of mortality. At the same time, cataract surgery, which is a treatment for the condition, has been shown to improve patients' quality of life and ability to perform critical daily living tasks, such as driving, cooking, reading, and even recognizing people. There are many risk factors for cataracts, and I've listed some of them on this slide. Pay particular attention to the risk factors on the left, namely diabetes, tobacco use, obesity, and hypertension, as these have been linked to lower socioeconomic status. So far, we have established that while refractive errors and cataracts can be debilitating conditions, effective treatments exist for both. Nevertheless, refractive errors are the second leading cause of blindness in the world and cause over $1 billion in loss of productivity. In 2010, cataracts were responsible for 1 in 3 people suffering from blindness worldwide. According to the American Academy of Ophthalmology, visual impairment is defined as 20/40 vision or worse in the better eye with eyeglasses. In the US, millions of people could have their vision improved by refractive correction. Cataracts, which are known to affect millions, constitute a major cause of blindness in the US. Based on the statistics we just reviewed, it becomes clear that the need for treatment is not being met. Let's explore some potential barriers to treatment. In 2000, the estimated value for a set of eyeglasses varied between approximately $90 and $180. At the same time, the average cost of cataract surgery in the US in 2019 was well over $3,000. For patients with health insurance, there is typically minimal to no out-of-pocket pay. However, for patients without insurance, the financial burden can be prohibitive. In fact, the link between lacking insurance coverage and having inadequately treated refractive error or cataracts is well documented. Additionally, one study reported that 50% of Latino patients who did not follow up with recommended eye care cited cost of care as reason for not doing so. Another barrier to treatment can be health literacy. 28% of Latino patients who did not follow up with recommended eye care cited lack of knowledge as to where to go for care. In a survey conducted between 2005 and 2006, Latino respondents were less likely to answer questions about eye health correctly than other racial and ethnic groups, potentially signifying a barrier to care for this population. The next barrier to treatment I would like to mention is transportation. This was listed as a large obstacle to receiving regular eye care by older African Americans. Finally, trust of eye care provider was the most commonly cited perceived barrier to eye care by older African Americans, with direct quotes from study participants, such as doctors treat patients differently if they are of a different race or cannot afford to pay, and the doctor leaves the room before I can ask questions. While the previous slides hinted at some possible social determinants of cataracts and refractive errors, let's now go over some specifics. Economic stability is an important determinant of how likely patients are to receive eye care or have adequate refractive correction. lower median income, higher rates of unemployment, and decreased healthcare coverage all have been correlated with greater cataract severity. Similarly, access to healthcare is a crucial component in increasing adequate refractive correction. Black race has been associated with decreased odds of receiving cataract surgery 5 years after diagnosis. It is important to note that this finding could not be explained by race-specific differences in disease prevalence. A study from the same year found that Hispanic and Black populations demonstrated higher rates of visual impairment that could be corrected with spectacles than other racial or ethnic groups. The final social determinant we will consider is environment. Many, though not all, studies have found that time spent outdoors can have a protective effect against developing myopia. Therefore, children who choose not to or are unable to go outside could show a higher incidence. With a deeper understanding of the social determinants of health, we now move on to guidelines for treatment. The primary indication for cataract surgery is visual function that does not meet the patient's needs. Therefore, patient decision-making will be crucial, and we should be mindful of potential barriers that could be preventing the patient from deciding to have surgery. Of the treatments for refractive errors covered earlier in the presentation, eyeglasses are the simplest and safest treatment available and are recommended as a first line of treatment. As we discussed earlier, they can be a less costly option than contact lenses or refractive surgery, which is important when cost is a barrier for patients. For more guidelines, visit the American Academy of Ophthalmology website. Remember that you can make a difference by first identifying patients at risk of these conditions, then taking the next step to investigate barriers to care before creating an individualized plan that will meet the needs and goals of your patient. When left untreated, cataracts and refractive errors have an enormous impact on patients' lives. Since effective treatments exist for both, it is important to understand barriers to care and social determinants of health leading to disparities. We discussed several barriers to treatment, such as cost, health literacy, and trust in eye care providers. Efforts to minimize disparities in the field of ophthalmology are ongoing. You can join these efforts on an individual level by considering potential barriers and determinants when seeing patients. Taking steps to build good relationships with patients, taking time to answer questions, and providing information about community resources could make a difference. That is all for this presentation. Thank you for watching.